and welcome back to my channel. I am doing a slightly different video today. It's not a makeup video. I am taking you with me to explore a beauty treatment, explore 3D facial contouring. I really want to investigate all these things that the celebs are getting done. I'm seeing that all our celebrities are looking kind of perfect, and you know, you sort of look back at pictures and think, you know, how come they're looking so flawless? And I'm always trying to figure out, I'm like, is it their makeup? But there's only so much flawless makeup can do. I know for sure that a lot of celebrities have had, you know, a bit of filler in the cheeks and a little bit of facial contouring. I am heading today to the celebrity doctor, Natali Kelly. I'm very excited, and we are going to be doing some 3D facial contouring on me, which should sort of just define and bring out my cheekbones a bit and stuff. Is this something that's really bothered me? No. Is it very vain that I'm doing this? Yes. Am I doing it more for research purposes? Yes. I would be lying if I said that I wasn't absolutely fascinated. The reasoning for me doing this whole series is because I am fascinated with all this modern day beauty. The only thing that I have had done in the terms of getting work done on my face are my lips. I have been getting my lips done for the past 3 years, and I've had some horrific lip fillers. And, you know, I've started to be a bit more safe and think about it a bit more and spend a bit more money, and they're starting to look good. Do I think my lips are perfect? No. Do I think you can get perfection with a lot of work? No. So I've never been aiming for perfect. I've just been aiming for, you know, enhancing what I've got. There's the celebs like, you know, Charlotte from Geordie Shore and Chloe Ferry, who are very open about the work that they've had done. And it's also more obvious though. So I want to go down the exploring this route of how, you know, can it look natural? Can I have like a subtle, beautiful difference? I know that this is something that's going to get judged a lot more. I am not trying to encourage anyone to get these treatments. My sister sort of said, one of my sisters was like, you're going to encourage people to get these treatments. But the way I look at it, and from being on the side of wanting to get stuff done, if you want to get it done, if anybody wants to get something done, they will find a way to get it. I certainly did 3 years ago, and the thing is if you don't have the knowledge about where's good or about it at all, then you end up being like me and getting a botched lip job, just because, you know, you want it done in the first place you hear of. You're like, great, I'll do it. So this is more me just trying to, yeah, give my insight to where's good. I'm not telling anyone to get these treatments. I am simply saying, this is what I'm doing, this is where I've gone, and these are the results. I'm just as curious as you guys are if you're watching this video, if it's a good idea. I don't know. I might come out looking awful, but with filler you can dissolve them. So, you know, anything that I'm doing isn't a permanent thing. I hope you enjoyed this video and enjoy coming with me. It should be a good one. Yeah. I'm gonna head into town now.
Hello Olivia, how are you?
I'm good, thank you. I'm excited for today.
Yes, so am I. Welcome to the clinic. I've been through your medical history. You're completely fit and well, so you are suitable for non-surgical treatment should you wish to have one. It's for you to tell me about your concerns.
My main concerns are at the moment, because I do a lot of photo stuff and video stuff, and I was actually quite smiley in my pictures.
Okay.
I'm starting to get these, which are fine. I know they're completely sort of a natural thing, but obviously because I'm taking a lot of pictures smiling, those for me are starting to become a bit of a concern. These here as well. My lips I had done recently. Smile, I get this sort of
a little bit of a ridge there.
Yeah, so I don't know, that at the moment is a concern. And also, I was watching back what I filmed earlier, and I don't know if there's much you can do for it, but crookedness where I speak. One side, I kind of sometimes look a bit like I've had a stroke. One side goes up more than the other.
Do a big smile for me? Yeah, this side, your muscles just a little bit stronger, so
yeah,
it's show more of your smile on this side.
Yeah.
Starting with sort of the face around here, of course the tiny lines sometimes near the eyes, you can do something like baby Botox to try and soften the lines. The alternative, which is a natural alternative, is to restore just a little bit more volume just around the corner of the eye and at the top of the cheekbone, which is actually the beauty spot.
Yeah.
So if you just elevate around this part here and give it a little bit of support, you find that sometimes the lines soften. And to use something like freezing, like Botox, and it's usually very safe and the results can last long. When you complain about this nasolabial area, now there's two approaches. So the older approach would be to inject exactly where you had the volume loss. Sometimes this can lead to an over-injecting of that area and this area looking quite puffy or looking like you have had dermal fillers. So a newer approach is to inject more along the cheek to actually lift the cheek back up, give it a bit of support, and in turn it softens the heaviness.
About the cheek fillers, obviously the celebrities that we know that have had cheek fillers are the slightly more extreme ones, like the Geordie Shore girls are really open about it. But I've been seeing so many, I'm not going to name any names, but people on Instagram that suddenly, and they've sort of lost weight with it or something, but suddenly they're all looking very flawless. And
well, that's really interesting because sometimes when you actually restore a bit more volume in the cheek, and sometimes when you put a little drop in the chin, you actually start to create more of this V shape, which does give the illusion that you have lost weight, or the face looks more contoured and lifted. If you put it in that outer aspect of the face rather than the inner, you actually create more of a lifted and contoured look. And if you just use tiny little droplets, we don't really want to over-enhance your cheek. You've got lovely natural fullness here, but of course from the age of 26, you will start to lose a little bit of volume. And what I do find with a lot of my clients who are very slim is, again, you don't have as much body fat on the face, so sometimes that just shows through that you feel like the skin doesn't feel as supported. So doing just a few tiny droplets of hyaluronic acid in my technique, which is called 3D facial contouring, so just spreading it around here, a little drop here and here, can just really sort of strobe the face and give it this more of this light reflecting look. Coming down to the lips, I think you've got great fullness to the lips, obviously from your previous injections, but I think you're missing a tiny bit of support in your philtrum columns here. So when you are smiling very big, like you do, you've got a great smile.
It's like a little shadow tap.
You see a little shadow or a ridge. And sometimes it's just when there's been too much filler placed in this middle tubercle, that when you animate, it looks great when you pout it, but when you animate and move, it doesn't have enough support and it starts to create a little crease. How does that all sound?
Perfect, that sounds amazing. So excited. Are there any risks? What are the side effects? Is there anything that I should be aware of coming up, after treatment?
Yeah, I think if you're going to do a dermal filler treatment, again, always ensure that it's non-permanent products. Today I'll be using Juvederm, which is one of my favourite brands. It's got hyaluronic acid as the ingredient. It's also got some lidocaine for comfort. You might get small risk of bruising, swelling. We have a few little things to follow, but as long as we practice slowly and safely, hopefully everything will go to plan.
Great, perfect.
We're just cleaning your face, some alcohol, kill any bacteria. Get ready to start. Just want to feel. Look at that. Okay, so deep breath for me. Just stay nice and relaxed. Breathing don't get very dry.
It's funny, it doesn't hurt, but it has a slight sensation.
Sting.
Yeah.
It's where you can feel the fluid.
Yeah,
the
yeah.
gel just pushing through the tissues. So if somebody injects it very hard with lots of pressure, that's what can cause the. Okay, just take it for me. So I'm going to come to do a little drop just in the chin.
Okay.
Take a nice deep breath.
Yeah, just breathe in.
Stay still.
not painful though. You just get the sensations of it, don't you? Which you would expect.
I'm going to do a little injection by the corner of the nose. This should stop you feeling this little fold there.
Yeah.
And also you get a little plus of that taken close to the nostrils a little bit, so it actually makes them a little bit smaller.
Amazing. My nostrils flow all the time, so anything to make them smaller.
Okay, it's a little bit of discomfort here, so just close your eyes for me. Stay nice and relaxed. Well done. Take a deep breath in. I'm sorry. You're doing great. Well done. Are you feeling any pain?
No, it's fine.
Okay. Stay nice and still. Do a little touch. Deep breath for me. Well done. Deep breath again. Sorry. Forward for me.
Oh yeah, it just lifts it a bit, doesn't it?
So here you can see you've got a little bit of elevation and lift. Here it's softened this and just looks much more in proportion, whereas if you look at this, can you see that? You hold that one. So if you look at the sagginess part of here compared to here is much tighter, and this part where you can see is actually missing a little bit flat, is now just got a tiny bit more projection.
Yeah, I just got like that rise there.
And if you just smile, this is starting to soften for the deepness. So we'll do that side and we'll assess afterwards if we've got any more there.
Perfect.
Just assessing. Okay, so take a nice deep breath for me. Tiny little bit flatter. I don't know if it's the side that maybe you sleep on. Sometimes that can happen.
Oh yeah, it is my sleep side.
I get used to that. So I'm going to put a little in extra here. Let's do this a bit closer. Okay, so we're going to move on to see if we can build a tiny little bit of support here for you. Now just try it here and here. I want you to take a nice deep breath in. I'm sorry. And breathe out for me. 1, 2, 3. How is that?
I see what you mean. It's a little bit more of a pinch. Again, just a
Deep breath in. Deep breath. Sorry. Deep breath here. Well done. It's the same on this side, and then deep breath here. Okay, just do that. I'm going to put one injection just in the middle and the bottom. Deep breath. Well done. Okay. And that's just to balance out because you've got a tiny bit more support on the top, so when you look from your side profile it just looks in unison a little bit more.
Is this one going to be painful?
Okay, so this one can be a little touch painful, but it's only going to be a few tiny injections.
Okay.
So bear with me, maybe 2 or 3, okay? Okay, so deep breath in.
I've never had my nose injected before.
It's
I
more
find
of
it fascinating. I don't feel.
pressure pain.
Yeah.
So I think what we should do now, a little bit of redness on the nose, it's always like this. We should sit you up and have a little look. I just want to look at everything, and it's mainly just this chin part where I'm just deciding whether I'll add just a little. I think
Really
still
interesting.
here, we just have a little bit of weakness and unevenness that's just spoiling
it's
our overall
this is
contour.
I've
So we'll
always
just do a little
noticed
touch
that.
more here, and then the jawline should be more structured in this nice view with the cheeks. Onto the chin, we're going to try and build just a little bit of support just around it near the lip. Now it is a tight space, so we use something called a cannula, which just means a longer blunt needle, so we would do one injection and then we would thread it through.
Okay.
It was a bit unusual, as in a little bit of pressure, so I'll go very slowly. And then if you just turn for me this way. That's great. How's this feeling?
Fine.
Okay, just keep your mind just relaxed over it, just stay asleep. You're doing great. That's quite odd, right?
Yeah, it does feel odd. Again, not bad, just odd.
It is starting to strengthen that. Okay, so we'll be doing the same on the other side. Take a nice deep breath. Just let me know if it feels too uncomfortable, okay? Just popped on some aftercare, just to help the skin to heal.
Oh my god, I love it. Again, I look the same, but just more.
We didn't want to change your features.
My chin's so much more even.
Beautiful.
That is crazy.
All we wanted to do is just build a bit more structure here, and we'll show you from your side profile.
It looks so
shortly
nice.
that you just have a little bit more.
And the nose is just a little bit, but not different.
Too much. Olivia, we're all done. How was your experience?
It was great. You know what? It's really not painful at all. And I am amazed about stuff like my chin. Again, it's one of those things that you've obviously got a professional trained eye, and you'd say you've trained for years looking at faces as a whole, and I wouldn't have even, for me, I'm most amazed by the chin. It's something that I would never have even thought about professional, and just looking at my face and sort of, you've done it so well. It's the tiniest little tweaks, like I'm looking in the mirror and I look the same, but just sort of fine tweaks.
Yeah, a bit better.
Yeah. It's like I wouldn't expect to go meet up with my friend on like Friday and then go, like, not recognise me. They might go, wow, you look amazing, have you lost weight or something? Do you know what I mean? But
these
they won't.
treatments are made just to improve your beauty, but your natural beauty. We don't want to take away from it.
Guys, thank you for coming with me to Natali Kelly. I hope you found it as interesting as I did. It's been 5 weeks now since my treatment, and I'm absolutely loving the results. The day after, I had no bruising, no discomfort, no pain. I went to go see some friends the day after. I went to an event and nobody noticed anything, nobody asked any questions, but they did say, oh, you're looking amazing at the moment, and have you lost weight, and etc, etc. So I definitely think that had something to do with it. The one thing, obviously, I can't stress enough is if you are going to get treatments like this, do go to a recommended professional doctor. You don't want to be playing with your face. Always spend a bit more money. If something's more money, it's probably going to be good when it comes to sort of treatments and stuff like getting filler and Botox and all of those. If anybody's doing on a budget, yeah, there's probably a reason for that. The good people are always going to charge more for their expertise. Natali was so professional, and I can't stress enough, if you want one of these treatments and you want something done, please do your research and go to a proper professionally trained doctor. If people are doing stuff, you know, at a discount price, then I think that should be major red flags. So always do your research and go somewhere professionally, because you'll spend more time trying to fix it, or you could end up with botched results. So please go somewhere great. I can definitely tell that my face looks a bit slimmer after having it done. My chin is a little bit more defined, which I wasn't too sure about at first, but now I'm really liking. Natali did say that the results look better over time, and I definitely noticed that. When I first got it done, everything felt a bit foreign, a bit extreme, and I don't know, it just didn't quite feel like my face. And then over time, the results are still there, but everything's sort of settled in, and it's looking really nice and really natural. Thanks so much for watching this video. Subscribe to my channel if you want to see more from me, and give me a thumbs up if you liked this video. It's a bit more of a controversial one, so I'm sure I will get some thumbs down. That's all right. As long as it's been insightful to everyone and they've, you know, enjoyed watching it, and that's all good. Find me on Instagram, it's Olivia Newman-Young, and my Twitter is Olivia_NY_. Until next time, bye guys.